Welcome everyone to today's webinar, Price and Quality Transparency is Coming. What does it mean? I'm Emma Goodman with Becker's Hospital Review. During today's webinar, you can submit any questions you have by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it's now my pleasure to start today's webinar by introducing our presenters. Serving the healthcare industry for over 15 years, Bill Klaus leads innovation and solution development for digital experience management at Change Healthcare. In his role, Bill is responsible for a portfolio of solutions that assist in the transition to a consumer-oriented healthcare system. Prior to his current role, Bill led business development planning, partnerships, and corporate development across a variety of healthcare service and technology lines of the business for McKesson and Change Healthcare. Prior to McKesson, Bill worked at McKinsey & Company as a strategy consultant, serving a variety of clients in healthcare and other industries. He also served as a lieutenant in the United States Navy. We're also pleased to have Deanne Kasim joining us today. Deanne is an accomplished healthcare and health IT subject matter expert, researcher, consultant, and professional speaker. Technology is often ahead of current policy and regulation in healthcare and life sciences. Deanne specializes in educating regulators and legislators on important issues and finds key opportunities amid change and chaos to create better policies and product roadmaps. In her current role with Change Healthcare, Deanne manages the policy strategy and advocacy functions across the enterprise for both federal and state issues. Deanne interprets legislative, regulatory, and industry trends to inform senior executives, drive business decisions, and guide product strategy and roadmaps. Deanne frequently meets with congressional and senior federal officials regarding many key policies issues, including the proposed rule on information blocking, updates to HIPAA and health data privacy rules, price and cost transparency, AI, NPL, and blockchain, value-based purchasing models, and more. Most recently, Deanne led a team in a presentation of price and quality transparency solutions and policy suggestions to CMS Center for Medicare. Lastly, we're pleased to be joined by Angela Evat. Angela serves as a manager of state health policy strategy for Change Healthcare. In her role, Angela focuses on state regulatory and legislative issues impacting the healthcare industry and advises on state advocacy efforts across the enterprise. At this time, I'm pleased to turn the floor over to Deanne to begin today's presentation.
Thank you, Emily. When we look at the overview of cost and price and quality transparency initiatives, much of this is related to legislation on surprise billing. But for now, what we'll focus on is the key parts on the federal side include a White House executive order and bipartisan legislative packages in both the House and Senate. Of all these moving parts, the common threads are mandating payments, whether for out-of-network providers when consumers had no choice, or knowledge of the fact that there's an out-of-network providers. And there's differing ideas on how to set those rates, whether it's benchmark rate setting and or arbitration, which we'll get into. And consumers must have estimated price information at the point of care in advance to support elective care choices. So as we look at an overview of the executive order on price and cost transparency that was issued in June of this year, the overall theme was really to make healthcare more transparent for consumers using a bunch of policy levers. First of all, it was to eliminate unnecessary barriers, also increase the availability of price and quality information directly to patients, enhance patients' control over their own resources, including the use of tax-preferred medical accounts such as an HSA, and also protecting patients from surprise medical bills. With this executive order, there is 4 buckets of proposed rules out of HHS, as well as Labor and Treasury. Labor and Treasury will speak to the expansion of HSA use. But with these proposed rules, they will support the business of the executive order. And we've already seen one of those proposed rules come out of CMS, comments closed for that rule the end of September, and that proposed rule would mandate that hospitals participating in Medicare and Medicaid have to make public on their website a list of all of their standard charges for common procedures and treatments, as well as the rates they have negotiated with the payers they participate with. So what's next for all of the pieces of the executive order? Well, to date, the reaction has been mixed. Doctors groups have been carefully supportive on the record. Hospitals and insurers have been in strong opposition, particularly to the requirement of sharing their negotiated rates online on hospital websites. And healthcare economists are divided as to whether these concepts will actually be effective in moving the needle on consumer transparency in healthcare. There are some aggressive timelines for rulemaking to support all the parts of the executive order, and it remains to be seen what strong industry pushback could have on the final rules, and also what legal challenges may or may not result to the final rules. When we look at the House of Representatives side of legislation, they started out earlier this year with a No Surprises Act. And this would actually prohibit surprise medical bills and hold patients harmless in emergency situations. It would also seek to increase transparency and empower patient choice. It would look to prohibit surprise medical bills from providers that patients cannot reasonably choose, and that would really target radiologists, anesthesiologists, and ER docs specifically. It would establish a market-based benchmark to resolve out-of-payment disputes in surprise billing situations between providers and insurers. So essentially, out-of-network providers in a surprise situation would agree to accept this market-based benchmark, and it would encourage the development of state all-payer claims databases. When we look at the Senate side, the Lower Healthcare Costs Act of 2019 was passed earlier this year, and this package would effectively try to end surprise billing by setting benchmark rates, although it is largely expected that arbitration as a backstop to benchmark rates will be added should the bill move forward at the end of this year. It would prohibit insurance contracts from including gag clauses, which is essentially barring providers from telling patients about all of their treatment options, including those with non-network providers. It would build a not-for-profit entity to build a national claims database. And it would also mandate that consumers must receive information on cost and quality more than what they receive today. It would require more accurate provider directories. And it would also require provider facilities to furnish all adjudicated bills to the patient as soon as practicable, but no later than 45 calendar days after discharge or visit, which really puts a focus on revenue cycle management and billing practices. And it would require all commercial health insurers to make information available to patients via APIs. So let's look at some opposing views on the congressional legislation regarding how rates should be set for out-of-network payments in surprise situations. So in terms of setting benchmark rates, the options proposed between the Senate and the House bills have included the following: setting rates as a percentage multiplier of Medicare payment rates, calculating the median rates for CPT codes by geography and provider type, using arbitration as the primary method, such as what the Major League Baseball industry does, or setting arbitration as a backstop to median benchmark rate setting. So in essence, out-of-network providers in a surprise situation, if they chose not to accept the median benchmark rate that was offered, they would go to arbitration as a backstop. Providers and payers have been disagreeing over what the best option should be, and it's now up to Congress to figure out what the best way is forward. In light of those disagreements, there has been a compromise bill emerge out of the Ways and Means Committee in the House. Committee leadership looked at siding either with arbitration or benchmark, which is essentially arbitration is preferred by providers and benchmark is largely preferred by payers. with respect to out-of-network rates. This bill would set up a negotiated rulemaking model. It would not preempt state laws, and it would create a stakeholder committee to formulate a proposal within 1 year's time, and that proposal would then go to the rulemaking process. Overall, there's been so much controversy over the different payment methods that it remains to be seen what will actually happen in Congress this year. However, there is promise on the state front, and with that, I will turn it over to Angela Evatt to talk about the state initiatives.
Great, thanks, Deanne. So there were several bills introduced in the 2019 session, over 140 bills actually, that were trying to address price transparency. These bills fall within three major categories, one being shop and reward programs. These programs require providers typically to establish a program to allow patients to compare costs on specific shoppable services and rewards them for choosing a lower cost service. Some bills require that the payers provide to the patient an estimate of the out-of-pocket costs to the patient of certain services, and the bills limit the program to only certain types of services, no, not all. Additionally, some bills put a floor on the percent of savings the patient can be rewarded. The second category is advance notice, or protections on surprise billing. These bills typically require a facility or provider to provide in advance an explanation of the charges for which a patient might be about to receive, and others prohibit or establish certain protections on balance billing. And then the third category is around data reporting. These bills designate or create a centralized state authority or body that maintains a database of healthcare charges that reflect the usual or customary charges for service. This is provided by healthcare providers, employers, and purchases. It allows the entities to continuously review healthcare utilization, expenditures, and performances in the state, and create cost-effective healthcare choices. So which bills went through and were enacted into law? Approximately 18 bills were signed into law in 13 states. In Florida, Tennessee, and Virginia is where we saw shop and reward bills signed into law. And there were several states that introduced and signed into law advance notice or surprise billing bills. These include California and Colorado and Missouri. For example, in Colorado, the law now requires healthcare providers, facilities, and health insurance carriers to provide disclosures to patients about the potential effects of receiving services from an out-of-network provider or an out-of-network facility. In addition, in Virginia, medical care facilities are required to provide an estimate to the patient of the payment amount for which the patient will be responsible for certain elective medical procedures. On the surprise billing front, we saw laws signed into effect in Missouri and Nevada, as well as in Washington, which prohibits balance billing for usually certain emergency services. And then finally, in Colorado and Virginia, we saw data reporting bills enacted. For example, in Virginia, they are now requiring certain groups to participate in all payer claims databases that weren't participating before. So now I'd like to turn it over to Bill Krause, who will speak about ways to increase price transparency in the industry.
Thank you, Angela. So today I'll share some of what our industry is doing in response to these trends and regulatory activities, as well as opportunities and to approach the issue of transparency in a way that will benefit consumers. I think it's important to consider transparency in the context of the larger shift towards a more consumer-oriented healthcare system. And really one of the big trends behind that is the increasing patient financial responsibility. So what I'll talk about today brings together transparency in the context of the overall patient financial job. And if you think about it, what's amazing is that patients today represent the third largest payer group after Medicare and Medicaid, which just a few years ago wasn't the case, but it's been a big growth in patient out-of-pocket responsibility. And with that growth, nearly 137 million Americans are facing financial hardship as a result of medical expenses in the past year alone. So this is truly at a crisis level from the standpoint of the patient financial burden and ways to help patients through expected and unexpected healthcare costs as they seek better health and better outcomes. Before I get into some of the solutions that different providers are adopting in the market today and ways to think about that, I thought it would be good to share for a minute or two some of the user-centered design research that Change Healthcare has conducted over the last number of years. Our point of view on this is that to really understand these shifts towards consumerism and the complexities of the patient financial experience, it's important to be in as close to the problems and situations as possible. So over the last few years, our design team has interviewed close to 1,500 patients, as well as providers and staff and administration personnel across healthcare to really understand and map out the consumer journey, the consumer healthcare journey. And that takes into account lots of differences in care episodes, technology systems, processes, all the factors that are necessary to really have a good understanding of the patient financial journey. And no question, healthcare journeys are changing. How patients or consumers seek information, ways in which they weigh trade-offs. Interestingly, research is now showing that millennials and Gen Xers are nearly half as likely to adhere to a provider referral suggestion as baby boomers. So that's a really big change, and that's one of many changes that's happening in today's market. And so those insights really come together into a playbook that we've developed for helping to enable modern healthcare consumer journeys. And as underneath that is a framework we use, which is 4 areas that are important from a user-centered design standpoint. Friction, which we would define as being the opposite of intuitive, the amount of effort required or number of steps at solving the issue at hand, confusion, and cost. So that framework of friction, effort, confusion, and cost is really important as we think about transparency and how to find opportunity in this. Because at the end of the day, solutions may exist, and in fact, many providers today have patient estimation solutions. Many payers today have price transparency solutions. But if they don't meet the tests of good design and making them easy and accessible, then they won't be used. And the research shows today that less than 5% of patients use price transparency tools today, even when available. So now I'll talk a little bit about some of the insights that have come out of that design research. There are a variety of tactical issues, but then there's also a broader approach and framework which we'll introduce that takes the typical consumer decision journey and applies that to price transparency, and as in doing so reveals different ways that our industry can help put in place approaches that will really meet the needs of consumers. From a more tactical standpoint, and thinking about that friction, effort, confusion, and cost framework, patients uniformly report that they don't like to, nobody likes surprises on the, and so that certainly will come out throughout the insights here. But typically what our research team is seeing is that patients today say costs don't align with expectations or perceived value. They typically are saying they don't feel like they were consulted or had a choice. And some express embarrassment in asking for cost information, even though they want that information. From an effort standpoint, there's lots of needs and pain points around reconciling patient financial responsibility with the explanation of benefits, the differences in billing cycles, trying to remember what happened and when, given bills are received oftentimes weeks after a service event. Certainly a fair amount of confusion in trying to interpret the bill and different language and jargon that's used to explain that to a consumer. And from a cost standpoint, continuing to struggle with understanding how plans such as high deductible plans require different ways in which patients should use healthcare savings accounts, no ideas as to what is covered and not. So a lot of questions and concerns continuing around the benefit policy and how that shows up when a patient receives care. Also, I would emphasize that patients are seeking very simple approaches, and we all know healthcare is not simple, but things that move along the lines of, and in some patients' words, McDonald's-style menu of care options. People want to know what to expect on the bill before it comes and to eliminate that surprise. So these insights, among others, are what's necessary to address when we think about the opportunity around transparency. So as I mentioned, we look at healthcare price transparency from that consumer decision journey standpoint and the steps that a consumer follows from initial awareness of a need through to the commitment and service experience, that overall journey, this journey that's used by many different consumer industries today in some form or fashion to tailor information and approaches to meet the specific needs that a consumer has at that stage and no more than those specific needs. Back to the point on eliminating frictions and making things easier and more understandable, it's important that not too much information is provided to a consumer at a particular stage. Likewise, making sure that consumers have access to the information that they need to support the next steps in their decision journey. So what you see on this slide is starting with awareness for a planned care event or some opportunity for a patient or consumer to understand directional ranges of pricing of what a procedure may cost, and that's window shopping. It's not a personalized financial responsibility, but it's a broad range of what to expect for a planned shoppable test or procedure. The next step is the consideration stage. So when a consumer is considering different options to fulfill that need, and from a healthcare standpoint, this is when it's important to provide personalized pricing, reflecting a member's benefit. It's contextually aware, so it takes into account different factors in that decision, and it provides additional access to resources to understand more specifics around maybe the benefit plan or follow-up questions, other things that would be follow-on needs that a consumer will have after that personalized pricing. So it's at that consideration stage that the member benefit pricing information is so important. Next is the stage when a consumer makes a commitment to a particular provider, and in the case of healthcare, we'll talk about the increasing need for pre-service payment solutions and making price transparency actionable and transaction ready. So these are techniques like being able to create a shopping cart that pulls together the different line item services into a single bill, perhaps incorporates some incentives, certainly payment options and other factors that really help with a transactability of that transparency information, which has been lacking in the industry for with many of the legacy solutions. So now I'm going to show a few examples of how these different stages and tactics show up. So from the window shopping stage, as I talked about, these provide local cost ranges for shoppable medical service and procedures back to those consumer needs, as well as the policy agenda that was discussed earlier. This provides an opportunity for patients to understand those general ranges, as well as other information that patients need to assess that value of that particular service. So things like integrating ratings and patient reviews, other factors, other information that will help in that first stage of the decision journey. And really this stage is what is designed for helping patients shop, essentially. So that's window shopping. Very simple, directional, local information, and wrapping in quality as well as cost. The next stage is that personalized pricing. So this, again, takes that generalized cost information and brings it down to an individual's level, which reflects their member benefit. This is where consumers understand what their out-of-pocket costs are and takes into account where they stand within their particular benefit plan. And there's lots of opportunities to include things like other information, such as where the service would take place. It's certainly important to include consumer-friendly language and to include other information that will help a patient put into context that personalized pricing and makes that information very easy, very accessible for a consumer to see and factor. The next stage is taking the consumer from understanding generally their information and their personalized price to a point when it can be transaction ready. And not all consumers will transact and purchase services prior to time of service, but making that option available where an experience can be almost e-commerce-like in its ability to allow a consumer to select that care event, to finance and pay for it, and complete that transaction prior to visiting the doctor. Increasingly, consumers will be shopping for their care, and we see these types of approaches now arising across different players in the industry, as certainly many organizations are taking a leading stance in helping to meet some of those needs that we explained earlier. I think it's also important as we take into account this transparency journey and what's important at each stage of that consumer decision journey to look at it from the standpoint of the provider's organization and how that fits within their existing revenue cycle operation and the patient experiences that they're designing and delivering to their consumers. And so this slide really shows that broad revenue cycle workflow from initial patient registration and QA through determining eligibility, through authorization, the billing cycle, and analytics that help understand that process and identifying ways to improve on that process. What I'd like to emphasize here, and I think it's those people on the webinar today that run revenue cycle operations are certainly well aware that it is up to 4 times more expensive to collect from patients than insurers. And the results are that that really 18 to 35 cents is generally the range of what is collected on every dollar billed to patients in a high deductible health plan after the cost of billing administration. So you think about the result and the cost to collect from patients, and those results are quite poor. So the industry is really focused on different ways to incorporate solutions into that revenue cycle to improve on that. So this is the opportunity to take into account the different solutions to support the consumer decision journey from a transparency standpoint and incorporate those into the revenue cycle such that patients have more information prior to time of service so it can inform their decision, it can inform their planning, and what the results are showing is actually counterintuitive. When that information is provided in advance, it turns out that net collection rates actually increase off of those levels that I discussed earlier. So it's a win for consumers because they have the information they're looking for, and it's a win for providers because their collection efforts and costs, their collection efforts improve through the results that that drives. So in summary, from a provider standpoint, is really a two-phased approach that we would recommend to get to move forward from a transparency standpoint. First is that retail-style shopping experience that provides price transparency information to patients, which we talked about, and then having the ability to provide estimations as well, so that a patient can access the information they need in a self-service manner through that shopping experience, and that's the left-hand side of the slide. And if a patient presents themselves at a provider or is working with their care provider to understand next steps in their care journey, that estimation solution is in place, driving off of provider data so that together all of those needs that patients seek are met from a transparency standpoint. And lastly, I would leave us with a few questions to consider as you think about your transparency strategy today and where your organization looks to take that over the next few years. The first is being prepared for all of that push, as we talked about from a regulatory and payer and really self-insured employer standpoint, as well as the pull side of transparency, given the changes in behaviors, decision-making, and how consumers are seeking information to support their care journey. And have you considered ways that your transparency roadmap can be a revenue driver and an efficiency driver? Again, the data is showing that as providers continue to equip patients with pre-service transparency information and solutions to support that pre-service journey, that providers are improving their financial outcomes and patients are improving their ability to plan and pay for care. I would also ask, does your pre-service transparency experience really integrate into that broader patient liability management? So what we mean by this question is, as you think about that overall end-to-end revenue cycle experience and where those patient financial touch points show up from pre-service to post-service, how are you thinking about integrating the data and integrating the communications to your patients so that they can really deal with the complexity of the overall financial experience in a much more streamlined and improved way? And lastly, it's the Amazon question, which I know this audience is asking itself. But if Amazon or another e-commerce retailer or other disruptor were to enter your market and provide that e-commerce experience for shoppable tests and procedures, what would you do differently? Thank you again for your time today, and we appreciate the opportunity to speak with you on this issue.
Thank you, Bill, Deanne, and Angela for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions that you have by typing them into the Q&A box you see on your dashboard, and we will get through as many questions as we have time for today. We've had a few questions come in already for the audience, and Bill, I'm going to throw this first question to you. This audience member says, some of us aren't the low-cost providers in our markets, so price transparency really could kill us. What should providers do today to prepare for new potential financial transparency regulations?
Well, there's a number of things, and I'll take it from the standpoint of not being the low-cost provider and how to think about that. First of all, the data shows that price is one of a number of inputs that a consumer makes in deciding whether to pursue care or where to pursue care. And so as you think about strategies to provide more information to your consumers around price transparency, also think about communicating the value propositions that your organization has related to quality, convenience, many other factors that create real value for consumers, and taking that holistic view. Secondly, this overall e-commerce revolution really has shown that those organizations that streamline and simplify the experience that their consumers go through, everything from accessing their product or service, all of the steps around that, those that make that incredibly easy win. And the experience is a more important factor to consumer decision making than price. And there's a lot of research out there that shows that. So that template, that approach of how you as a provider can just make it incredibly easy for your consumers to access your care and navigate through the steps in their care journey and do that in a way that's digital, because that's how consumers want it. Those things are going to be very important in selection and will become perhaps even more important than price by itself.
Fantastic. That is super helpful. So thank you for providing those tips to our audience today, Bill. I think a great next question would maybe be best for you, Deanne, and a similar question, but for the payer audience. So, Deanne, perhaps that you can provide us some best practices and tips for how the payer teams should be preparing for this executive order.
Absolutely. So as we know, Seema Verma and the rest of the administration at CMS is very committed to building on the successes of the Blue Button program in Medicare, which is basically using APIs to give consumers access to all of their payer data. And so looking at the executive order, that is something that CMS wants to do for all commercial payers, and we've certainly seen that in the legislation in Congress. To Bill's point, it's also about the consumer experience. So payers have a lot of that cost and quality data on their members and on different providers, and that's something that they could try to make more amenable in terms of analytics. I think the key will be negotiating those relationships with their providers and being able to use that data to better enable a consumer experience, from whether it's shopping to actually choosing care to paying for it.
Excellent. Thank you so much, Deanne, for providing that perspective. And it looks like we have time for just one more question here. And Angela, I'd love to throw this your way, as I know that you talked about it a little bit earlier in the presentation. But can you clarify for us what states are acting on transparency in 2020?
Sure. So we saw several bills introduced that didn't necessarily make it to the end of the finish line. But we are definitely keeping an eye on several states that introduced shop and reward bills. These states include Illinois, Minnesota, Oklahoma, and Alaska. And I mentioned those because those states have basically tagged those bills to be carried over to the 2020 session. So we'll likely see those resurface again. On the advance notice side, I would keep an eye on Oklahoma. They also have a bill that was introduced and is going to be carried over to 2020. And then on the transparency front, also Massachusetts. Massachusetts has a Center for Health Information and Analytics that has a website to provide cost and quality information to consumers, and they're looking to potentially build a more robust website with additional data elements. So in Massachusetts, there could be some additional bills being introduced to require some reporting on that end for their website.
Thank you so much, Angela, for providing those additional details. That is all the time that we have for today. I want to thank Bill, Deanne, and Angela for their excellent presentation and to Change Healthcare for sponsoring today's webinar. We hope that you enjoy the rest of your day, and we look forward to having you join us for future programs.